Welcome to Labor on the Job. I'm the host, Steve Zeltzer. Tonight we're going to be looking at the Kaiser medical plan and how it operates and how it's regulated, how it's affecting workers and consumers. And 30% of the patients in California are covered by Kaiser. It's the largest HMO in the United States. And joining me are a number of guests, so welcome to the show tonight. The first one is Dr. Charles Phillips. Welcome to the show.
Glad to be here.
Dr. Phillips. And you were a Kaiser doctor?
Yes, I was a Kaiser doctor for 18 months. Had a chance to see it from the inside. I actually was briefly a Kaiser patient when I had no choice some years later, just to sort of touch base again, make sure I was keeping tabs on them, and I've certainly studied them ever since. So I interact with Kaiser all over the country.
Okay, welcome to the show tonight, Doctor.
Thank you. Glad to be here.
And also joining us is Barbara Clark. Welcome to the show, Barbara.
Thank you.
And you're a nurse practitioner and are in a struggle around your case as an injured worker and also to get the Department of Industrial Relations to properly regulate the self-insured employers like Kaiser.
That's correct, and there's the similarity is the self-insurance aspect of it.
And most people are unaware that their company could be self-insured, which means that if you get injured, you have to go to them to get your injury taken care of.
That is basically correct. What goes on is that when the company is self-insured, it basically can make all the decisions when it comes to your health care. They pretty much have the say-so on a lot of stuff. And so that's why a lot of people are going that way, because the self-insured programs, there's more control for them versus regulation from the outside.
Okay, thanks for joining us tonight. And also joining us is Dina Padilla. Welcome to the show, Dina.
Thank you. Good to be here.
And you're a longtime advocate for Kaiser workers and also injured workers in California nationally.
That's correct.
And you were working at Kaiser?
I worked for Kaiser from 85 to 89, got fired, first time being on workers' comp, went back to work in 89 and got fired again in 93 for being on workers' comp.
And you were also a shop steward of SEIU?
That's correct. I was a shop steward for SEIU Local 250 under Sal Roselli. And also on the Sacramento Central Board Council, I was executive board member for 2 years while being a union steward, the only union steward is on the board.
I see. Well, that was a good thing, actually, that they had a real union steward on the board.
Yeah, I learned a lot.
Okay, well, thanks for joining us.
Thank you.
And also joining us is April Gottman. Welcome to the show, April.
Thank you.
And you were a Kaiser worker?
Yes, for 22 years, from December 1970 to December 1973.
And what Kaiser did you work at?
Arden Way.
Arden Way in Sacramento. And you were terminated?
Yes.
Were you injured when you were terminated?
Yes. It was a
Isn't that illegal?
work-related injury, yes. It is, but it happened.
It happened. Okay, well, thanks for joining us,
Thank
April.
you.
And last but not least, welcome to the show. This is David Sweigert. And David, you're a consultant and investigator around the issue of HIPAA, privacy of records, and also you are involved in the issue of workers' comp deregulation here in California.
Yeah, thank you. It's a pleasure to be here. It's always very impressive to meet with the people in California that have suffered under this system. My personal involvement is mainly in litigation support. I'm directly involved in Barb Clark's case. However, we're starting to see more and more people approach some East Coast law firms that I work with, primarily about the self-insured problem that seems to be in California, and a lot of attorneys in California don't want to touch this. So we've learned a lot in the last year and a half, so I'm kind of an expert witness in how this is all set up in the regulatory and the oversight, that kind of stuff.
Okay, well, thanks for joining us, and I think we have a lot to learn. Now, Dr. Phillips, you came to Kaiser fresh from experience in medicine, and do you have any idea what you were getting involved in Kaiser?
No, I'd really been out of the country for a little bit. I'd been, at one point, the emergency doctor for the King of Saudi Arabia, and another point, I was setting up the paramedic system in Guam. So I came back like brand new again to California, and the university said, why don't you go over to Kaiser on our behalf and represent the university physicians. And so I went over and was an emergency doctor in Kaiser, and I saw things that I hadn't seen in the third world in Kaiser, and I'm still writing about it.
And what were those things you saw that disturbed you about how Kaiser operated?
I saw, for example, pill splitting, where particularly the elderly would come in with their brown bags of pills, but I would look inside and they would have these fragmented pieces of I call them garbage, but medications that have been ruined in the process of getting them to the patient. And that has resulted in thousands of hours unto itself to try to get that solved, even 2 days ago with the Board of Pharmacy.
Is that legal?
We sort of tested that with and $1 million was spent on either side, and the judges basically said it really is up to the Board of Pharmacy to take a stand. And when I saw them 2 days ago in San Diego, they did agree that they would step up and really study it for the first time.
So, so you're saying Kaiser was doing that for financial reasons? Was telling people to split their pills?
And the VA started it, and Kaiser was quick to follow. Is that about 1994, the double-sized pill ended up costing the same as a single pill, and therefore to split it in two is like you generated a pill for the same cost. The trouble is they don't split in half. And so they split in fragments and sometimes dust. And so what the patient gets in the end is all sorts of sizes. So one day the blood pressure is high, one day low. And this
could be dangerous, is what you're saying.
Absolutely. It looks like it's saving the senior in some ways some money, or it's saving Kaiser. It really all goes to Kaiser. But in fact, it's endangering each person with their own illness, whatever it be that's jumping around.
Did this surprise you that Kaiser was doing something like this?
Everything they did surprised me. That was one of my many surprises. Ordering CAT scans and then being told that I was ordering too many. It was all kept on an oral basis so they wouldn't generate any paperwork. But there's hundreds of influences whereby you're supposed to marginalize care.
So they were trying to mold you.
They were trying to see if I was managed care suitable. That's their term. And at one point they offered me job thinking that perhaps I was, and I said, no, I've got to keep a foot in the outside world because I want to preserve my ethic. But Kaiser's test doctors for 2 years to see if they can change their ethic from the Hippocratic Oath over to what's called on their own map the group ethic.
And what is that? What's the difference between the Hippocratic Oath and the group ethic?
Well, the Hippocratic Oath says that you fundamentally have a duty to the individual patient as a solemn oath and even a covenant, meaning you're in trouble in this world and the next if you don't keep it up. And that is, and hypocrisy is said to free or slave. And that's what everyone white coat ceremony is about for every medical student. And what we walk in the room with is we're portraying that you as a patient, whether you be a patient or an injured worker, that we are going to give you patient advocacy. Mm-hmm. The group ethic says that we don't have to quite do it that way, that somehow there's this fundamental exchange of money whereby we better protect the money for the big group, which is really the group of doctors on the way to the bank, unfortunately. But it's phrased as if it's protecting it for the uninsured, keeping our rates low. So the group ethic becomes the alternative way not to give you a CAT scan, to split your pills, to send you home with a stroke, to make sure if I saw an injured worker, I had to get them over to the comp clinic within 3 days, even though I knew it was a 20-day injury. Hundreds of ways in which I was supposed to mold patients, whether they be members or employed patients, into this ethic, which is really not ethical.
Well, most people think that Kaiser is a nonprofit institution, that all the money that is collected by Kaiser goes to the health care. You're saying that that's not the case?
No, the Kaiser plan technically turns over all its money, so it comes out at the end of the year looking as if it didn't make a profit. But in fact, the goal every year is to make at least maybe 6% profit, like $2 billion. And that is split by the Tahoe Accord with the doctors. And so in 2004, they made $2 billion. Half went to the doctors, and that's where it all disappears.
You mean plus their salaries?
Plus their salaries. So the average doctor is making $200,000 a year and gets almost a doubling effect into a golden retirement.
Is that the incentive to get into the HMO mold?
That is the absolute incentive that makes the, sometimes I use Death Star, sorry, but to make the engine, to make the engine of the system going. And there was only 2 years in 60 when the doctors didn't make a profit. And they described that looking like Rangers after the Yellowstone fire, is that they were just bewildered, and they recreated a tougher system in 1998 became even tougher. So I see everything they were doing got doubly tough after that year.
I see. Well, that's interesting. We'll get back to that. Now, Barbara, you have been fighting the Department of Industrial Relations, which in California is supposed to regulate self-insured employers like Kaiser. The Department of Industrial Relations, how are they doing in regulating these large HMOs like Kaiser, which care or responsible for millions of people?
Well, basically, from what I found in looking at the whole thing, there is really no regulatory thing going on. They just kind of, the self-insurance plans, they pretty much do what they want to do. And then if it is reported, or whoever is supposed to enforce any kind of regulations, nothing is enforced. It's the people that do complain just get letters that said, you know, there is nothing we can do. They're all intertwined. And so really...
So who is regulating Kaiser?
Basically, Kaiser does its own thing. It does its own thing. And like Dr. Phillips was saying, the things he saw are the same things I saw even in the Adventist hospitals. The pill splitting, the not sending people home with stroke, sending people home, you know, not better, that kind of thing. It's a real common thing. And these, especially self-insured entities and hospitals like Kaiser or Adventist Health, these hospitals, they get away with it because no matter who you go to for enforcement or go up the chain of command, it's like they just turn around and they'll come up with all kinds of things, and then the government, there is no government regulatory.
So basically that's the way it is, and
yeah.
Just take it and...
take it or leave it.
Take it or leave it, and that was a shocking thing to learn probably, huh?
It's very disturbing because, like Dr. Phillips said, the same thing is in the nursing world. You take an oath, you're going to take care of your patients, you're going to be that patient's advocate, you're going to make sure that that patient is taken care of, that their wishes, that they understand what's going on, that you explain their... I mean, the nurse is a real teaching role, and we're the first defense. We're kind of the communicator between the doctors and everything else. So we're there to help the patient answer the fundamental questions, you know, guide them through the process of being ill or a ill situation in a hospital. And when you're told from from management or anything, oh, you're not allowed to change their bed when they're wet or when it's soiled because, you know, it costs money, and you're not allowed to do this, you start feeling like your ethics, your whole idea, and I just refuse to go along with that. I wouldn't stand for it.
Thanks. And Dina, you were representing as a shop steward and a member of the union, SEIU Kaiser workers, and you yourself were injured. What were the problems, some of the problems of representing Kaiser workers in the system?
Well, I think probably, there was two problems, because we had management creating the problems, and then we had the lack of union representation from the union, Local 250, hospital healthcare workers under Sal Roselli, and I had been bringing many grievances, many problems. Most of that stuff was buried, literally. I mean, they had a grievance track that they weren't even putting most of my stuff on. I've got like 5 journals for about the last 2 years that I worked, and bringing all these issues to the union, and I was getting blown off. I mean, nobody was listening to me.
What did they say? Why were they refusing to go forward with the grievances and try to deal with the problems?
Well, they really weren't saying much of anything. I mean, I had attended a contract bargaining agreement negotiation in 1992, and what I realized is that all 27 facilities were all having the same problems. I thought it was exclusive to 1 or 2 buildings in Sacramento, when I found out it's all of Sacramento, but it's all of the 27. So many of the union stewards all had the same story. They all had the same problems. But, you know, we couldn't get anything done.
So there was a systemic problem.
Correct. Correct.
And the union was not addressing it as a systemic problem.
No, as a matter of fact, I would go ahead and say that the union was helping Kaiser get rid of the injured workers, as well as allowing all the unhealthy environment, not addressing the health and safety issues. We had asbestos in the building, we had chemical spills, we had sexual harassment, we had all different types of discriminatory acts, and just many work-related issues that nobody was addressing, and that the union was letting it just go by.
Well, why would a union, which is supposed to represent the workers, you pay them union dues, not taking these issues forward and representing the workers?
Well, because SEIU and Kaiser are in partnership. They have been. They made it legal in 1997, but it had been going on for a long time, so it was past practice, made it official in 1997. So they are a partnership.
Now, April, you were a worker there. You were also a shop steward?
In the very beginning.
In the very beginning, you were a shop steward. And then how did you get injured on the job? What happened?
Well, I was developing neck and back problems. They had built a new desk that wasn't functionable for my type of job.
What kind of job did you have?
I was doing both x-ray and lab reception work.
I see. Uh-huh.
And which was an oddity because most of the other departments, other clinics had their own x-ray department and their own lab, but I was combined. And then Dina was my shop steward at the time I started to go like this. And I was called in on time off, that I was taking too much time off work, and Dina had to remind me that my father had died that year. So they didn't explain why the hours were taken. They just threw these numbers at me, and Dina said, well, wasn't that when your father passed away? Because you're allowed 5 days for funeral leave and stuff. So basically toward the end there, I wasn't a functioning human being anymore.
Mm-hmm.
Part of the problem with April's situation is that she was working 2 jobs, but she was only getting paid for one, which is an issue that I brought to the union because she was
multitasking.
Multitask, but she should have never been. Because
was that allowable in the contract?
No.
So they were basically violating the contract.
It was brought to their attention.
But this was very common, people doing more than one job out of their classification. This was ongoing. People were doing, one person could be doing 2 or 3 jobs that they didn't belong doing.
And what does that mean for care? If somebody's doing a bunch of different things.
I was crying in front of the patients. They were saying, "Oh, honey, things will be okay."
Well, so the stress level must have been pretty.
There was one thing that really I tried to impress upon the union and the Kaiser management, that the people were overworked, and they didn't want to hear it, because what they were doing is they were combining these departments to save money. That was their ultimate goal. And people were ending up with repetitive stress injuries, which is what April suffered, with, like many other Kaiser workers suffered repetitive stress injuries. Mm-hmm. And then with that, a lot of them were going out on psych stress rather than orthopedic stress. And the Kaiser records would reflect that, but none of the Kaiser records were even brought in.
So they didn't really want to show that as a result of work practices, people were getting injuries that were a result of the work conditions.
That's correct.
And they didn't want to show that.
No, because it was all being kept in-house.
So it was all a mental thing. It's all in your head.
It's
a
all in your
psychological
head.
problem. I see. So that's the problem.
Right.
Now, David, one of the issues about Kaiser and what the big corporations and now the Bush administration are saying is that basically, healthcare is expensive and we've got to make it more efficient. And part of that is medical records, which we'll get into. We're going to get them all electronically available, and that'll make it better for everybody, and you get better care, and that's why everybody should be in the Kaiser plan, the HMO. That's kind of the argument. What is the reality behind that?
There's a lot of window dressing right now. There's a lot of nice things, and it sounds efficient. It sounds like this is a good thing. Who would be against not sharing medical information? The problem is what you see more and more and more is the medical information is used to coerce, let's say, an injured worker. Workers' comp records are not covered by the National Medical Privacy Law.
Why is that?
The states vowed for an exemption to that. So the HIPAA, which you'll normally hear, any doctor's office will say, oh my God, we're HIPAA compliant, we can't discuss anything except for work comp records. So I could have any one of work comp records right now and toss them on the table here. Absolutely no liability I would face. Now, you start talking about interconnecting these records and sharing records, right? You already don't have any control of any real teeth of protecting these records. Can you imagine now that they would be shared under HIPAA currently? All medical records are shared by bill collectors, employers, state governments.
So bill collectors can get your medical records?
Yes, yes.
What basis is there to get your medical records for a bill collector?
That's a good question, good question. What ends up happening is these people will come in and say, well, we are business partners of the hospital. So they will extend the use of the medical record to quote-unquote business partners. So business partners include law firms, they include collection agencies, et cetera. And quite frankly, there's been many cases, and work comp just highlights it. It's more acute in work comp because of the lax regulatory framework. But oftentimes they'll just take people's names, send them over to a collection agency and to a law firm. They'll start generating hundreds of letters to collect all these fees and whatnot. And they'll use the medical records as a form of extortion and coercion. They'll say, well, you know, Ms. Smith, if your employer ever found out about your spinal injury, what would they say? And it's back to
so in other words, you're saying they're terrorizing workers using the medical records that should be confidential, but under the deregulative deregulatory climate, they're using these medical records in a retaliatory manner?
Yeah, and I say that as a pretext to, can you imagine when this is all electrified? Right now it's papers floating around. When this becomes part of a national framework or a patchwork of different computer systems, what ends up happening is all the hospitals will want to be in a big rush, because the problem with a hospital is, and correct me if I speak out of turn, is they want to be able to go to the community and say, we're offering all these wonderful, great services. So as part of offering all these wonderful, great services, they want to say, oh, well, we have the electronic medical record thing that you've heard so much about. So right now, the current administration is pushing all the hospitals through state government to hurry up and jump on this bandwagon. The problem is the security issues haven't been figured out, the privacy issues haven't been figured out, the state legal issues about state laws regarding privacy, they haven't been figured out, but there's this massive rush to start sharing medical records.
And in your case, Barbara, you were one of the workers, injured workers, who
Yes.
was actually terrorized by the Adventist Corporation using your medical records. Why don't you talk about how that happened?
And what happened in my case was that they had sent me to a psychiatrist who had written this report that was, there were a lot of wrong statements made and diagnosed me wrong and everything. And all my medical records were going to the defense attorney. Well, the defense attorney, which I believe was his way of harassing me and also doing, generating billable increments for his benefit, he would send out the medical records to everyone he could think of. And my psychiatric record, my psychiatric report, actually ended up back at the hospital with one of the people that was on this list. She wasn't a lien claimant or anything. And they passed it around. And
So they were just passing around your private medical records?
Yes, yes. And then the way I even found out this was going on was I got a call from someone from the inside who called me up and said, well, you know what they're talking about, yeah, that you're crazy because Dr. So-and-so said, and I was like, I was shocked.
Now imagine that on a national scale.
I was shocked.
Imagine now that we have that electric and we can start developing software programs to screen specific things, share the information amongst ourselves, your life's over at that point.
So, I mean, Dr. Phillips, Dina, why don't you
Well, I wanted to add in is with the worker comp records is that under the labor code, they can have access to your medical records, everything that they want. I mean, but what's really sad is that there's your family records, family history that also goes in there, because when you're being evaluated by the QMEs or whoever.
What's a QME?
It's a qualified medical examiner who's a doctor that the defense will send you to, or your you will be sent to by your attorney for an evaluation to determine where you're at, what your injury is.
So you can't just go to any doctor. You've got to go to a QME.
No, you cannot. But they have access to everything, and you have your own personal information from the time you're born. You have your family's information. They have access to everybody's information, so it's not just your information that's in there. And they'll go back to everything if they can find anything or that you've put on paper filling out a form to when you were a child.
So they're looking to cut costs and to say that they're not really responsible.
Correct.
For your injury. So the whole driving force, and that's what I was going to ask you, Dr. Phillips. I mean, you're saying that basically the thrust of HMOs, Kaiser and other HMOs, is to increase their profit, ratio, or to create a situation where, they can cut costs. Is that?
Well, they even as they started the HMO bill back in 1973, the Kaiser family member went to Nixon and Ehrlichman and gave the general formula as we make money if we don't give out care.
So they went to
Nixon. It's on the presidential tape. So
so if you go to where do you find that out?
University of Virginia has we have it on the website, kaiserpapers.info.
Okay, kaiserpapers.info.
But it comes from the university, so we didn't make it up. It comes from the University of Virginia, where they have the presidential papers, and we separately got that conversation where Erling is reporting from the Kaiser family member. He told me how it works. We make money in withholding care. And Nixon said, well, that sounds okay.
So they sold it?
They sold it as a way not to give care, and they're still doing that. One of the Kaiser family members is now going to be in prison 6 months for a $2 million scam, but they switched him off the Kaiser board and have someone else there who's an airline pilot. But the Kaiser family system has always been part of the Kaiser board, part of the Kaiser plan, which is you get the money first, and then you make a profit by not spending it. It's a pretty simple formula.
And you say that, I mean, lawyers who deal with Kaiser have certain benefits?
Yeah, one of my problems, people ask me, what's the Kaiser attorney to get me as a patient on my side, and I have to hesitate because I've seen too many that start out on the patient side and then become the devil's advocate, sort of framing the other side's position, and pretty soon I start saying, I think we've switched over. We're sounding more like the devil than the devil's advocate. And suddenly it settles, and the patients settle for absolutely nothing, and then it seems like a lot of these attorneys end up at the Bohemian Club as a Kaiser guest in the San Francisco, and I'm tired of that circuit. Because I end up, if I'm ever recommending a name, saying
well, I mean, these
it's hard to find a lawyer who's going to take it on through.
I mean, this negotiation that workers have to go through if they have an injury with lawyers. I mean, why do you have to negotiate about health care if you're injured on the job? I mean, why should you have to negotiate over health care? If you're injured on the job, shouldn't you have to just have your health care taken care of?
Well, I mean, that's the way Hippocrates would set it up. It's been altered in, call it managed cost mangled care.
And we have a chart actually that you brought along, and we've seen that chart before, I think. Yeah.
Well, just to make it more visual, because Kaiser actually had a San Francisco firm develop a chart for all new doctors to see how it all works, and we were lucky enough to enhance it and have it available here from their own. So it's their own. They published
this is their chart?
Yeah,
Yes.
This actually came out of the Permanent Journal and is online, but in a faded way. All we had to do is enhance it so that people could actually, because my only goal is transparency. And so this map is transparent to their ethic and their style, both to the worker. They, by the way, if I could, is they call the patient an external customer. They call the employee an internal customer. They try to change the patient into a business model, which is like if you don't like your fries, you can get them down the street from somebody else. You can't, as a patient, go down the street and get other fries. You're fried. You're basically, you're in one place, and if you don't get the right stuff, you can't move. You're injured, you'll be forever
locked
tied.
in.
Especially when, like Kaiser and some others, end up to be the comp carrier, self-insured. You're stuck in every way.
You're locked in.
You're cooked.
So this is a frightening thing for people who are having serious problems with Kaiser. I mean,
well, it's very frightening that it's all set up. There is no door out, and then you are dependent on your records, which they electronically and otherwise destroy. I've never seen a case that wasn't tampered, and I think there should be.
You've never seen a case that wasn't tampered?
I've never seen a Kaiser set of records that had not been tampered with.
And how do they tamper them?
There's 100 ways. They can tamper them by removing material. They can add material. We've seen on men's X-rays, women's necklaces.
Yeah.
They can substitute. They have a way to magnify the top and the bottom. To me, it's cut and paste. When I often am called to help a patient recreate their record, and it's cut and paste, where I have to go back and see what's missing. I'm sure it's thrown down some staircase, because one of my jobs is to get it back even in order.
This sounds like a nightmare, and there are no criminal penalties for this kind of
There
thing?
apparently used to be some law in California that's been erased where there was a separate liability for wrecking records. There is none now. And I keep thinking at the very least it should reverse the burden of proof, whereby if they've destroyed your record, they better prove they gave you care. But we have a hard time. It's just that you have a wrecked record. And what happened about 8 years ago, the Supreme Court of California called in Ngala versus Kaiser, said it was an awful system. The time was all wrong, and it wasn't independent. So they moved it independent, shortened the time, but now they wrecked the records. So the Supreme Court needs to look again and see if it's just as awful as it ever was. It's very unfair, and it, as I say, it's cut and paste to put a record back together.
And the worst part about it is they own your claim.
Yes.
Is so if it's a self-insured entity like Kaiser or the Adventists, you can't get out. They don't have an external insurance company. They don't have a third-party administrator administrating the claim, because if they used an insurance company, they would fall under California Department of Insurance and Steve Posner, correct? If it's a self-insured, we set our own standards, we do it our way, and then in Barbara's case, they could manage her claim for the next 20 years. And just nickel and dime her on this and nickel and dime her on that and mess up her record.
So these, what you're saying, David, is that as there's pressure to go into the become self-insured, that this is going to mean even more problems for people who are locked into this system.
Dog ate my homework. I mean, it's ridiculous. I mean, it's laughable to us here, but it's like, well, we lost that report. We don't know what happened to that report. Well, why are you such bumbling, fumbling fools? We're self-insured. We don't have to. We don't have any standards. Well, isn't an enforcement regulator going to come in and talk to you? No, there's only 2 people at the Department of Industrial Relations that manage us.
So there are only 2 people.
2 full-time auditors dedicated to doing targeted auditing of a work comp claim in a self-insured program.
So and the Department of Industrial Relations only has 2 people.
2 full-time auditors for that function.
And we're talking plans that cover millions of people.
Yeah.
How do they cover the plan at Kaiser?
It's a lot of, I think, purposely, and I'll just my observation is don't fund the regulatory side. Don't put any teeth into the auditing. Put the funds in other things like $17,000 conference tables and plush carpeting and trips to conferences. And typically what you see, like with Carrie Nevins, who is the administrator of the Division of Workers' Comp, her real job is to go around to conferences around the country and tell everyone that everything's great in California. We've reformed California. SB 899 is the best thing that ever happened.
And SB 899 deregulated workers' comp, cut penalties for injured workers or payments.
Exactly. But what you see happening is all the money is put into PR. All the money is put into press releases coming out of the governor's office saying everything's wonderful, everything's great, there's nothing to worry about, it's all under control. And all these press releases go to the insurance industry, to insurance conferences and what have you, to let the insurance industry know that we've got it all under control in California. But the internet and these websites are getting the message out to the people in the rest of the country that, hey, California's a mess and it's becoming laughable right now.
And at barbclark.org. Now Barb, you are, as I said, suing the John Rhea.
Yes.
Who's the director of the Department of Industrial Relations.
Yes.
Precisely because that department is not enforcing the regulations for self-employed companies, self-insured employers.
It's basically what it comes down to. It's right now in the Ninth Circuit on appeal, Ninth Circuit of Appeal. All the pleadings have been put in. And basically what it comes down to is the issue of pain avoidance. Everyone has a right to pain avoidance, pain-free, get treatment for your pain, which is one of the very most basic things someone can offer a patient, is to be pain-free.
Isn't that part of the Hippocrates?
Yeah, it also is pretty close to Pursuit of Happiness.
Yeah, but it's a basic thing, pain-free. And that includes treatment, diagnosis, those kind of things.
Sure.
Carrie Nevins herself came out and said in a press release, herself, out of her words, saying 30,000 injured workers are in constant pain. There are cases out there.
Unfairly, by the way.
Yeah.
Unfairly in constant.
In other words, Carrie Nevins, who's the director of workers' compensation,
Yes.
acting director
Yes.
in California, said 30,000 injured workers
Are unfairly in
are
constant pain.
not getting pain medication.
Correct. They're not getting anything for pain. Their pain isn't being treated, be it via pain medication, proper diagnostic
Therapy,
studies,
whatever it is.
is.
So that sounds like a serious problem for 30,000 workers. It's could be a living hell.
I think I'm speaking. I can speak out of my own experience. My injury was in 1994, and until last July, I don't think a single day went by where I was not in excruciating pain, walking around with a broken neck. And the headaches, the pain, the deterioration of the condition, the frustration, not sleeping, like I was explaining. I mean, sleep is your most basic thing you can do. You get, and I see these with these injured workers all the time. They're in pain, they get into sleep deprivation, they can't catch up on their sleep, they can't eat properly, their nutrition is going down, and it all has to do with not treating these people. They might have a broken arm, it's all the other issues regarding the pain is they can't get back to
And
work.
it basically is a whole deterioration and
It's a
destruction
whole
of their
deterioration,
life.
it's a whole destruction of the human whole mind, body, and soul, and that is what this whole thing is about in the Ninth Circuit, is that because you have these self-insurance plans and because they're basically doing their own thing, the state has basically said, you know, we're going to give you a certificate to do something, you promised you were going to do it, and they're not doing it. And I think it's going to be a really interesting thing for the Ninth Circuit to look at, because we see it in the abortion issues, the avoidance for pain. We see it in the medical marijuana field. We see it in the dignity to die field. You know, people have rights to be pain-free.
That's what California
these
doesn't
rights.
understand, is that people have a right to avoid this kind of debilitating
So they don't have to
pain.
live like this.
No.
No, it's cruelty.
It's
I'll be
cruelty.
the first one to say it. I think the state of California is inflicting cruel, unusual pain. If Barb Clark was a prisoner, she would have more rights
Rights.
as a California prisoner than she would as an injured worker, because then under the 8th Amendment, they would at least step in and say this is cruel and unusual. She would get her pain medication if she was
So
in
if she was
Folsom
in prison, she was in Folsom Prison, she would have more rights than
Yes.
she does
Right.
as an injured worker
Yes.
in the state of California.
in the state of
Right.
California. Dina?
Yeah, I just want to say about the 30,000 is that it's my understanding that there's about 1 million people that get injured in the state of California a year, which the statistics are kept they're hidden because of Cal OSHA no longer being able to function.
They
Those
pretty
that-
much, why aren't they able to function, Cal OSHA?
They've gutted it like they've done all the other agencies, just like the 2 gentlemen that are working audit for the whole state of California. So, you know, they make these agencies dysfunctional, and it's going to say that government's not working for you. I mean, that's a great...
Well, don't you have self-regulation? The companies kind of helping regulate themselves?
Well, I had like a self-regulatory company called Kaiser, and look where I am today. You know, I'm disabled, permanently disabled.
And you still have problems from your injury at
Oh,
Kaiser?
absolutely. Yeah, I still really need 2 surgeries. I don't know if I'm beyond surgery at this point. I have deteriorated. It's getting worse. Nobody told me it was going to get worse.
And
you know.
Kaiser is fighting you, or why
Well,
can't you
I'm
get
still
this?
fighting with Kaiser. I'm trying to get my records so I can go through to a trial.
Well,
through-
why don't they give you your records?
I don't know.
What do they say?
Well, they haven't said anything. They just said basically, along with the Judge Volkin said that they were going to penalize me and sanction me if I wanted to go forward with a serious and willful trial. And I've already sent a letter to the Kevin Ryan, who has since been fired, a U.S. attorney, to Philip Carney, to the California Bar Association, and one to Ted Richards from Gransel, Leibowitz, and etc., trying to get my records, and I can't. So it's preventing me from going forward.
Isn't there a law that you're able to get your records? I mean, why shouldn't you be able to get your medical records?
Well, there is a law. In fact, you're supposed to have only 15 business days, but no one's really enforcing whatever they send you, whether it's complete or sometimes we have triple copies of what we don't want and no copies of what we do want. That's considered an event of sharing records. And it's an awful system where people can't have their basic rights. There was a blue ribbon committee that Kaiser actually appointed to look at all this, and they said that a patient should always have a complete set of records just as quickly as any attorney they might want to. That's never been done. And
Well, aren't there sanctions? I mean, it seems like, what you're saying is basically they do what they want.
they do what they want. The only sanction is you send people something. So in fact, people get something, and I'm the one that usually gets the end of that, and I have to throw 2/3 away as duplicate and have to make a whole list of what's missing. It is terrible fraud.
And even with the
And there should be a separate issue to itself.
And if it's electronic, it's even going to be more
Yeah.
problematic. Isn't it?
Absolutely. Electronically, right now they can electronically, and they have done it. They'll select. It's called selective deletion. So if potassium's your focus, you'll find that's selectively deleted out of a Kaiser patient's record, whereas something that might be favorable to their position is still there. We don't know where it went. It's been selectively deleted. It's
In
a
fact,
keystroke.
So it's a keystroke.
The power of the internet, let's say there's a liability against a pharmaceutical. You could say delete all Vioxx references from everyone's medical records in the United States.
It's gone.
And just,
And do you think that that's one of the driving forces behind this?
I'm not sure, but I would say that the privacy advocates have been beaten down so much that the privacy people have kind of faded away. It's all driven by profit. You know, this is going to be more efficient. The country's not ready for it. As an expert in computer technology and state regulations and how those two marry up to each other, there was such a big push for this and what the administration goes to the states says, well, we'll cut off your funding, or we're going to reduce your funding and Medicare allowances and things like that unless you embrace this new model of sharing these records.
So they're pushing this through. They're driving this through.
They're driving it through. They're cracking the whip, and they want this whole nationwide network brought up for record sharing. Well, personally, you know, I mean, especially as an ER doctor, if you walk into the ER with an injury, I'm not sure you need to know that in 8th grade I had the measles. I'm not sure that's really going to help you treat my broken arm. So that's a lot of the questions that haven't been worked out, and the privacy people and the consensus of the country as a whole should be stepping in and saying, do we really want this, instead of sliding it under some funding mandates and having it deployed without our
So they have an agenda really, which is driving this, which is not necessarily the interest of the consumer, of the injured worker, or the people who have to use these, have health care.
Yeah, I'm very disappointed with the Department of Health and Human Services and what they're really doing about privacy advocacy and protecting people's records. They've thrown it into the wind. They really don't care. It's just push, push, push. Whoever's got the big checkbook who wants to do things.
I think one thing I might want to interject that's becoming a big problem is that people are living longer. We know that. And there's going to be a greater amount of elderly patients to be taken care of. We're on the cutting edge of all the baby boomers getting ready to retire. So there's going to be this huge amount of people that are going to be retiring. These people are going to live longer. So we're talking much more health care. The big problem is going to be, if all this health information is out there and everyone knows everyone's problems, who's to say that an insurance company is going to come along and say, well, Mr. Jones, we're not going to insure you because you have diabetes, or you broke your leg 3 times when you were a teenager, and those kind of things. And I think that's one of the reasons that's really going to hit hard in the baby boomer society that's growing older.
I agree.
Kaiser, if I could, on that point, Kaiser just got a $100,000 fine about a month ago because they like to pull people back out. They wait till they have some condition like renal failure. Then they go back out and see if they can find some piece of information that doesn't quite fit a long time ago. And they'll say, well, now we no longer have responsibility to your kidneys because your application wasn't perfect way back here. Department of Managed Health Care, they do very little, but they at least got this one, as to say that's $100,000 fine for trying to go back. And so this information can be used. It's not the HIPAA, HIPAA is not a patient-friendly device as it's being sold to the world.
I see. Dina, what were you going to?
Well, I just wanted to mention is that when I was there in 1992 and all the injured workers, all the workers that were going out the door through workers' comp, is that most of them were hitting around the age of 40.
Yeah.
So there was this age biasness, and it was, my contention is that, okay, they not only got their work-related injuries that were deliberate, but is that, you know, the body, that's when they say the middle age, is that we're going to start falling apart with one thing or the other, and that it was going to be cost-effective for them to get rid of the older worker.
And the maturing workforce. That's
The
the correct
maturing
way to say
workforce,
that,
there you go.
And April, what happened in your case? I mean, you were injured and you tried to take care of yourself, and I mean, you still are. Are you still having trouble getting medical care and getting treatment?
Well, they got me on the Social Security system really quick through worker comp, and then after being, it was supposed to be a disability retirement, but after about 3 years, I was just kicked off the system. So that's just another fight altogether.
Well, what does that mean, you're kicked off the system? Why don't you talk about that? What does that mean? Because, I mean, somebody has to pay. You have to get your treatments. I mean, what does it mean being kicked off the system? I mean...
Well, one day I got a letter, and it just said that I didn't show up for an appointment, and there were going to be no more checks. And
Social Security
that's
checks.
about 6 years ago, so it's kind of hard to remember everything, how it happened. But I went to the office and filed an appeal, And then they told me that I never filed for an appeal. I had the paperwork to prove that I filed for an appeal. That still wasn't good enough. And so then they set me up with a doctor's appointment. The doctor didn't show up for the appointment, so it looked bad on my part because it just showed that I wasn't seen. So there was just a lot of stuff, a lot of misinformation, a lot of lies, and so.
So if you are getting your health care taken care of, who's taking care of it?
I have no health care, but.
See,
You have no health care. So you were injured on the job at Kaiser, and you had an injury as a result of your job, and they fired you, and now you're without health care? Is that what you're
I
saying?
have been, yeah, for
And she worked
15
for the company
years.
for 22 years. That you know, up to 30 years you would get full medical care. But under the 1992 contract bargaining agreement, anybody who worked there prior to 1992 we were supposed to be umbrellaed in terms of getting full health care. Well, that didn't happen. So it was just really coincidental that after 1992, all these people were going out the door. The mature worker were going out the door. So April should have had care through workers' comp from Kaiser as a patient employee and through Social Security, and she has nothing.
I mean, it sounds pretty frightening. I mean, here you're an
It
injured
is.
worker. They're in charge of all your medical records.
Yeah.
They're in charge of everything, and you go to them, and they're self-insured employer,
Yeah.
and you're trying to fight with them over getting proper treatment, and then you're left basically without any medical care. I mean, it sounds scandalous, really.
Yeah,
Well,
for
we
the-
went to Matsui's office the other day, last week, and they've had her.
That's the Sacramento congressman.
That's correct, and they've had her case there for 6 years and haven't done anything on her behalf because she's been cut off for 6 years. So my question is why? You know, what has been happening? I mean, that's her congressperson. You know, she's been there several
Well,
times.
the Democrats now have a majority in the House. They can have hearings on this.
Yes.
They can subpoena people. I mean, there's also the issue of cost shifting because in your case, April, others, I mean, if you have to go to a hospital and you don't have a medical insurance, then you end up going to a public hospital. And who's paying for that? The public.
Right.
For a situation in which you were injured on the job, and the employer should be paying for it, which is an example of cost shifting, where these companies can shift off to the taxpayer what should be their responsibility. And yet it seems like the Congress is really not doing anything around that issue of cost shifting.
Well,
David?
you know, the real scary comment came from Don Parada, who's the president pro tem of the California Senate. And when they were discussing the California Universal Health Plan in December, he said, well, it's going to be based on like California work comp. So again, you see the PR coming out again, like, oh, the poor uninsured people, they have to go to the ER to get treated. This is all PR. It's just more and more PR about, well, we have to get together and work this all out. And
This is Don Parada, the leader,
Yeah, he said
Democratic
we're-
leader
Yeah.
of the California Senate.
he
Yes.
said we're going to base the California Universal Uninsured Health Program on work comp. And there was a fly in the ointment because the Fourth Circuit Court in Richmond, Virginia, ruled on a Walmart case where they said the state can't come in and create these insurance programs. It's a federal issue. That's why a lot of the people in the country are looking at Barb's lawsuit, and I would, you know, join with them and saying, you know, injured workers, it's time to drag all this into federal court and say enough's enough and sue these people and say, look, I got a right to pain avoidance. This is my last resort. You know, people are getting this in other areas, right? I'm an injured worker. The state's stopping me from getting my medication. I'm suing the state.
Well, it sounds like it should be a basic right
It is.
of
is.
justice.
It is.
But injured workers are not getting that right.
Haven't
Is that,
been.
Well,
I mean, that's,
haven't
it is a basic right, you know, to the pain avoidance issue because it's like earlier said, if I were in a prison, I would get treatment, okay? I have been forced into the work comp system because had I used my private insurance, then it would have been fraud. So I was, and that's one of the...
so you'd be charged with a felony.
Yes,
That's
I would
right.
be
For,
charged with fraud. So I am, the state has forced me into this work comp system. Basically, the state is saying, you have to use the work comp system because you got injured on the job. My employer or my ex-employer is self-insured. They regulate or they own the claim, and the state cannot hold anyone accountable. So basically and that's one of the things in the Ninth Circuit, and I think this is so important, basically boils down to the very basics of pain avoidance. Injured workers really need to step up to the plate and understand, and so do all the other people,
That
because
they could be injured too? Or
I think they should have a class action lawsuit.
They should
I
have
think,
class
I think
action
injured workers in California should say enough's enough, we've had it, and get together and file a class action lawsuit. And just as California has not done a very good job with the prison system, and the Department of Justice has stepped in because of the Eighth Amendment violations, the federal government, Department of Labor, Health and Human Services, whoever it has to be, needs to step in and say, in this particular area of disputed pain avoidance, of last resort pain medication, there's not going to be a discussion. If an injured worker has to have this, he or she is going to get it.
Okay, now we are joined now by telephone with. Oh, okay. Well, we're going to be joined by Ron Panzer of the Hospice Association that represents hospice people who are, close to death and what happens to them. Is that pain avoidance?
Yes, that's your death to day. I mean, pain-free.
The technical term would be last resort. So, for instance, an injured worker, especially I think in Barb's case or a spinal surgery case, you're living in constant pain, and then she goes in.
Okay, we're going to go to Ron. Welcome to the show, Ron. Are you on the air?
Yes.
Okay, Ron. Now we've been talking about Kaiser and the profit drive at Kaiser and how this affects the patients and workers at Kaiser. So, what has been your experience with Kaiser patients in the hospice program?
Well, I've spoken to family members whose loved ones have been either killed or have received inferior services where the corporation is cutting corners to make their profit. I've spoken to actual employees who are working inside Kaiser who are basically undercover in a way, whistleblowers in a sense, who have told me that there are very deceptive business practices going on there.
We have a chart here. Maybe we can show that. Now, I mean, what do you mean by defective practices? I mean, why don't you talk about the hospice program and what is happening in that program as far as practices?
Well, the problem with corporations and the profit motive when it comes to end-of-life care is that the money is flowing into the corporation through Medicare, Medicaid, or private insurance, and when they cut services, then basically they're taking the money but not spending the money on services for the patient. In some cases, there are patients,
Ron Panzer,
you know the case of Vicki Travis, where her father was actually listed as being deceased even though he was still alive, and all that time the corporation is taking in money to provide care, and they were providing minimal services. And
why don't we go to this chart? I mean, can we get this chart up here? Yeah.
The problem is that patients at the end of life require a full range of services, and hospices are very big at advertising, promoting themselves to the families and the community, as saying, we'll be there when you need us. They are big on promising, and what happens is once they're there, they've got their claws basically in, and they will. The tune is changed once the patient is enrolled in the hospice. So if they do not provide the therapy that's needed, say you have a stroke patient who has cancer, but they're not at the end of life, at the very end stage, they could benefit from therapy, which is a required service that the hospice provides. But most hospices never provide that service. They only have, I've been in contact with therapists who say they're listed as the therapist for the hospice, but they're never used, even if they go on a case to evaluate whether therapy would be effective. When they say therapy would be effective, the manager of the hospice does not approve it, so then the patient ends up not getting the therapy that they would benefit from, and which would help to improve the quality of their life, even though the hospice is taking in the full reimbursement for their daily, the daily rate, depending on what level of care that patient is at.
So you're saying this is a cost-saving scheme of Kaiser's. They collect the money, but they're not really providing the services that they say they are providing under the hospice program.
Well, yeah, there are many hospices. Kaiser Odyssey Hospice is another hospice that a huge hospice corporation that was found by the Justice Department to be defrauding Medicare for many, many millions of dollars. And the problem with our Justice Department in the United States is that even if they find massive fraud, they enter into what are called corporate integrity agreements with the corporation, which is basically a settlement, and the corporation agrees to reimburse or pay back what they stole from Medicare or from the federal government.
So it's basically a slap on the hand.
And it's usually 10% of the total fraud. It's
Right.
usually like a $10
In
million.
other words, they pay back some. So when they go in, before they do the fraud, they know going in that, yes, if we do this fraud, we're going to make, millions of dollars. If we get caught, the worst that can happen is we'll get a citation and maybe a little news story, a blip
But they
in
can
the
do
news,
that.
but they're going to be
basically get
rewarded
away
for
with it.
committing fraud.
Yeah.
And Ron, how can people get in touch with you or get more information about what you've been doing?
Well, they can go online to Hospice Patients Alliance at hospicepatients.org.
Okay.
And find a complete list of services that should be provided, the warning signs of what would be deficient.
Okay. Well, we'll get back to you maybe in a future program. We want to thank you for joining us, Ron.
Okay, well, thank you very much for having me.
And thank you all guests for being
You're
on the
welcome.
program.
Thank you
and
for letting us be here.
I'm glad we were able to cover this. So.